Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Laryngeal mask airway. Laryngeal mask airway was found out by Archie's brain, so it is called as brain's mask. Laryngeal mask airway can be used up to 40 times. Uses of laryngeal mask airway: emergency airway for failed or difficult intubation and for elective intubation. Advantages of laryngeal mask airway. Laryngeal mask airway is easy to use. No laryngoscope is required. No muscle relaxants are required. Laryngoscope can be used in fracture of cervical spine. In laryngoscope, we will have to avoid the complications of intubation. Laryngeal mask airway can also be used in cervical spine fracture, and laryngeal mask airway can also be used to avoid complications of intubation. Disadvantages of laryngeal mask airway. Laryngeal mask airway will result in laryngospasm and aspiration. Laryngeal mask airway is found out by Archie's brain, so it is called as brain mask airway. It is a supraglottic airway device. It is easy and faster to insert. It is less invasive. So this laryngeal mask airway is an emergency airway. It can be used for emergency techniques, or it can also be used for elective techniques. The main advantages are it is easy to use, no need of or no requirement of laryngoscope, and there is no requirement of muscle relaxants. It can be used in fracture cervical spine, and also it is mainly used to avoid the complications of intubation which might occur in some individuals. And disadvantages of laryngeal mask airway are laryngospasm and aspiration. Cuff pressure of laryngeal mask airway is 40 to 60 centimeters of water. It should not be more than 30 centimeters of water.
thank you and thank you for watching.